Well, good evening and welcome to the Thursday 7 o'clock talk. And tonight we're going to discuss A1C, blood sugar, and insulin. What is the difference? Because there's a big difference between those, isn't there?
Yep.
And I don't know how many times we have people come in and I ask them what their fasting insulin is, and they look at me and they will tell me their fasting insulin is a 7 or an 8 or a 10 or something like that. And then I'll ask them, is that an A1C or an insulin? And they will say, well, I don't know. And so typically,
Hey, Miss Kathy.
hello, Kathy. We're going to do our little ad real quick. I know you saw this last week, Kathy, but for those of you that do not know, we have a chance to get a hold of some massage chairs at a discount, and we are getting ready to replace the two chairs at the clinic. And so this is the new 7.1, comes with a 3-year warranty, has the legs built in right now in that picture. Right here, they have the leg rest flipped around. That little switch right there is what allows that to turn over, and then you can put your legs into that, and it will massage them. These are wonderful chairs. Ours now are about 10 years old, and they see a lot of use, and they've been fabulous. So highly recommend them. If you ever thought about a massage chair, I highly recommend these. They are medical grade, heavy duty.
They're heated.
Yeah, and instead of $27.22, we can get those delivered to the clinic for $2,100, and we can help you get them wherever else they need to go. Now, on to the important stuff. So, what is an A1C?
An A1C is so basically it takes 30 days to change that, and it's the average for the glucose. So your cells regenerate every 30 days. So when the cells are broken down, it releases back into your bloodstream. So what is emptied into your bloodstream, it's the average of 30 days blood sugars.
So
you can change that in 30 days.
Yes. Actually, we've seen people change it in a couple of weeks because they get on the stuff that we put them on, whether it be a berberine or a cinnamon or whatever it is. It really changes rather fast, and it's an average. So you start to change it now, and it will start to change the average almost immediately. But what is said in medicine is an A1C of 5.7 is pre-diabetic, and if you are at a 6, then you have diabetes. Most functional medicine doctors do not like A1C for diagnosing diabetes. We actually use A1C as a metric of inflammation, because if you have a infection, if you're injured, if you're worried, if you've been eating crappy, whatever the case may be, those all raise blood sugar. So this metric is a little longer standing metric, and we can start to tell how somebody has been doing over the course of time with A1C. But technically, it's a good measure for what is inflammation. Now, Nurse Jessica, what is glucose?
What is glucose?
Yeah, what's it do in the body? How do we use it? Why do we watch it? Why do we monitor it?
Well, glucose brings you quick energy from sugars, but you can also get it from fat. It's brain food.
So glucose comes into the body, and believe it or not, it's not our energy source. The glucose goes into the body, then it goes into the cell, then it goes into the mitochondria, and that is then gone into the citric acid cycle or Krebs cycle, which means nothing to you guys other than when it goes into the Krebs cycle, it gets turned into ATP,
energy,
adenosine triphosphate. That's actually what we run on. And you can put glucose in, or you can put ketones in. Hello? And that will be what gives you ATP. So you want to be metabolically flexible. You want to be able to run off of glucose or ketones.
Yes. Sugar or fat.
Yep.
5th grade level.
And so now we want to get to what is a true measure of diabetes, inflammation, and health. And the number that almost no doctors do is the fasting insulin. Why is fasting insulin? Why is insulin so important?
Why is it important?
Yeah.
Well, it regulates the sugar in your bloodstream.
So what happens if you just let your sugar go willy wonky crazy?
You'll get insulin. You'll get hyper and what's the word?
Bounce off the walls crazy.
Hyperglycemia.
Yes, thank you. Anyway, that causes all kinds of problems. That causes problems in the body with inflammation. It causes your vessels to be destroyed. You can't heal. You could go into a coma. Any seizures, anything. So lots of things can happen for hyperglycemia.
So one of insulin's primary function, which is very important in us, is to turn off ketone production in the liver. Problem is we all eat so many carbohydrates now that we never produce ketones. And we need ketones. Ketones are a very clean energy. And ketones, so since I'm metabolically flexible, ketones will allow me to not run off of glucose. So what happens is when I get low blood sugar, when my blood sugar goes down, I'm getting phone calls. When my blood sugar goes down, then what happens is my ketones take over and give me constant energy. So when I was watching my blood sugar when I was doing CrossFit bounce off of the 30s and the 40s, that tells me two things. One is my insulin is too high. Number two is that I was beginning to get metabolically flexible because I didn't pass out. And if your system only runs off of blood sugar, then you bonk. And so what are some ways to tell if you run just off of glucose?
Oh, you get sweat. If it gets low, you get sweaty. You're hungry. You're irritable. They get shaky. They get pale.
Angry.
But so people don't understand this. So people that go through fasting for medical procedures, or they're sick, and somebody that would take their blood sugar. So if you come in, from the nursing. Most people don't understand this, but from a nursing perspective, you come in for surgery and your blood sugars are rolling along and you've not eaten anything by mouth, and then all of a sudden they start spiking up. physicians and other medical professionals sometimes will think that they have eaten when they actually haven't eaten. Their body has switched over from sugar to fat. So it starts breaking down the fat for fuel, which raises the blood sugar. And eventually, if they fasted longer, then it would go back down.
So the other thing that insulin does, the secondary function, is to have what is called the GLUT transporter. So this is inside the cell. Have the GLUT transporter reach up into the extracellular space, grab onto the sugar, and bring it in. So it helps put sugar into the cell so it goes into the mitochondria to produce ATP. Insulin is the controlling factor. That's what we have to realize. We have for so long worried about blood sugar that we don't even look at the other parts of this. We just look at, blood sugar. Well, what's your fasting blood sugar? And of all the things that are most variable, this one, glucose, is most variable. Typically, in the morning, your cortisol spikes, and then it comes down throughout the day. When your cortisol spikes up here, you could have nothing in your stomach, and guess what's going to happen? Your blood sugar is going to raise. It goes up.
And that's a syndrome. What is it called?
That's called the Dawn syndrome. And so it goes up. This is like looking at your RPM meter on your engine and trying to drive according to that. And it changes if you let up a little bit on your foot. It changes if you push down a little harder. Whatever the case may be, glucose is not the measure that we need to see. And if you're taking glucoses throughout the day like I do, you don't want to see glucose vary by greater than 40 milligrams per deciliter. So you want to keep a very tight range. So between 75 and basically 100. And when I say 100, that's when you're eating. You want your glucose to stay basically in here. I mean, if you eat something, you can take it up to about 115. I just got the new numbers from the Institute for Functional Medicine, and the new numbers were saying they never want to see your blood sugar go above a 115.
And the difference between a functional medicine practice and a medical practice is a medical practice won't treat blood sugars less than 150.
And you're considered diabetic at 126. And there's all kinds of stuff going on. So what ends up happening is A1C lets us look how crazy your blood sugars have been. So what is a good A1C?
Well, and also to add to that, an A1C, so a medical doctor would check an A1C to determine whether or not how closely a diabetic is controlled. Because if their A1C is higher than what they expect it to be, then that means that their blood sugars aren't staying in a normal range.
Oh, I didn't know that. Yeah. So A1C in a functional medicine realm, we want your A1C to definitely be less than 5. Definitely less than 5, or should say less than or equal to 5. Ideal is right at about 4.8. Now there's a lot of variability in this as well. Because if you've been an endurance athlete, I've played soccer since I was 4. I have done triathlons. I have done all kinds of I like endurance sports. My A1C, because my red blood cells last longer, my A1C is normally going to be a little higher, but I'm still around that 5. I generally run at a 5 or a 5.2. Now, with 30 days of crappy food, it was a little higher. I think I was at a 5.6 or 5.5, but I know it's going down. Actually, I'll take my A1C next week because that'll be the 3rd week of cleaning myself up. So A1C, we like ideally 4.8. Glucose, ideal, optimal, fasting should be between 75 and 85 milligrams per deciliter. That is what your fasting blood sugar should be. So if you get up in the morning and you take your fasting blood sugar and it's a 100 or a 110, wait about an hour, hour and a half, take it again. And if you take it again and then it's down in that range, you're doing all right. So here is the controlling factor. This is the guy that pulls the levers. What should his numbers be? Ideal, optimal. Do you know? Have I told you?
I've not heard this one.
Fasting insulin should be between 3 and 4. And so if you have a fasting insulin between 3 and 4, you're awesome. You definitely want it to be below 6. Anything greater than 6, you're starting to have, and there is all kinds of correlating data to this, but greater than 6 is coronary heart disease, diabetes, atherosclerosis, dementia,
But a good marker,
Alzheimer's.
whether you are having high insulin or not, that everybody can tell, is if you look at the back of somebody's neck and it looks like it's gray or it's dirty, and you can scrub it all you want to, but you're not going to scrub it off. But that dirty gray Niger is correlated to high blood sugars, prediabetes or diabetes. But you're headed there, or you're already there.
Acanthosis nigrans. That's the $2 word for the day.
There you go.
But we really need to start asking our MDs to do this test, do the fasting insulin test, because there are a plethora of guys like me who are doing this test, seeing diabetics come in with, case in point, I have a patient who is a female that absolutely loves to, she's a socialite. And so she has perfect blood sugars. Her blood sugar is absolutely fabulous, but she's having a hard time losing weight. And so I said, well, let's run a fasting insulin on you. And so when we did the fasting insulin on her, and I also ran a liver enzyme on her, her fasting insulin came back at a 19. So unfortunately, if you go back and you look through our videos and you look at the videos that say how labs get their values, a 19 is actually okay for the lab values. And so if you go look outside and you look at the health and well-being of our population, and a 19 is okay, do you really think this? And so let's go back to how did they come to the 3 to 4 for the fasting insulin? They went back and they pulled the servicemen's blood from as far back as they could go, and they started to do the assays on that blood. So go look at a picture. I love this. Go look at a picture of Woodstock and try to find a person that looks like me. I mean, I would be an obese individual at Woodstock. And there isn't anybody that looks like me, because they're all skinny as rails. They've all got 6-pack abs. And I had one pretty quick, smart aleck patient look at me and goes, well, that's because they were all on drugs. And I just stopped for a second, looked at him, said, and we're not. And he goes, good point. And our drugs today, I mean, you can get amphetamines, you can get, God, whatever it is that's rotting the teeth out of, what's this? Meth. Meth is amphetamines on steroids, and the people taking meth aren't even skinny anymore.
No, they're not.
And so it's not the drugs, it's what we're eating. So after that, I was like, ooh, that's pretty bad. But it's for this person, she's like, that's not that bad, and my medical doctor didn't say anything. So we looked at the liver enzyme ALT. So if you want to go back to optimal, fasting insulin optimal is between 3 and 4. ALT, when they went back and tested that, was less than 20. This patient's ALT was a 56. Even in the labs, even LabCorp says, LabCorp says less than 40. This is absolutely fatty liver. She has undiagnosed fatty liver disease, and her medical doctor either hasn't tested it, hasn't caught it, or I don't know, but this has been allowed to go on.
Well, this person, there's a reason why their ALTs were high.
But it doesn't matter. I've seen diabetics with that as well.
But they don't know what a big precursor for your ALT enzymes to be high is alcohol.
And fruit juice.
Sugar. Alcohol and sugar mimic the same things in the body.
I actually don't say sucrose, table sugar, not as bad as fruit juice, fructose. So fructose, people who drink sodas
might as well just be drinking the beer.
Will blow this away.
Yeah.
And so it is absolutely destroying us from the inside out. If you watch our other podcast, our Tuesday talks, we discuss with other healthcare people, we discuss what they would do. I would absolutely, the last question that I asked them is, if you were czar for a day, what would you change? And if I posed that question to me, junk food, fast food would be gone.
Well, most of them always say nutrition, fat food.
Yeah.
But you can change this. This is like most people say, well, if you're diabetic forever. That's not necessarily true. And we have somebody really close to us that was sick, went to the doctor. Her blood sugars were between 300 and 400. They immediately wanted to put her on insulin. She didn't want insulin. She comes back to us for help, and she asked the doctor just to give her 30 days to see if she could turn it around. And the doctor didn't really think that she could, but all we tweaked was her diet. We prepped her food for 30 days, and when she went back to her doctor, she had almost a normal blood sugar and had dropped her A1C several points.
And lost like 20 some odd pounds.
And she does not take insulin. I believe she takes oral oral
metformin.
Yes, but she still is not on insulin, and she's still working
to get this.
Yeah.
And this is the thing. The patient that I was talking about with the ALT of a 56 and the fasting insulin of a 19, her blood sugar was perfect. And that's because her insulin can go so high that it keeps it very tightly controlled.
But eventually your body will stop doing that.
Eventually.
It accommodates it, but
she's in the second stage before prediabetes, because her insulin is real high, and when her pancreas fatigues out, boom, it's going to drop. And then what's going to happen is she's going to see her blood sugar go. And then she's going to, any infection's going to be limb threatening. I mean, I get so upset over this, it's not even funny. Because honestly, when I was a child, growing up in the 70s, my mother was highly intelligent and was never taught that. Here's something funny. Think about this: table sugar. This is a combination of sucrose and fructose. Glycemic index, you would think that table sugar would be the standard, the 100%. Table sugar is an 80 on glycemic index. White bread is a 100 on the glycemic index. So you can eat a tablespoonful of sugar and it will have less of an effect on your blood sugar than a piece of bread. And we've not been told this. What does the bottom of the food pyramid say you should have 6 or 7 helpings of?
Well, I can talk to this all day long because this is something I'm very passionate about, and it really irritates me because I was a nurse on the floor for 12 years.
Oh, God, yes. The hospital food.
And the hospital food would come out every day, and we would be like, whoa, 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 you can't eat that. There's bread on your tray. There's pasta. And then we quickly realized that the plate of food for the diabetic is the exact same food as the person next door that doesn't have diabetes. The only thing different on their tray was this person got table sugar and this person got the pink or the yellow stuff.
Yeah.
So they got the exact amount of carbs, and then we were still covering it with insulin. And then the flip of that is you have people, highly intelligent professional people, who you would think that would be educated enough to know, with diabetes, swigging down their Mountain Dews as we're taking off their toes. And it starts with your toe, and then it's your foot, and then it's your leg. And they just don't stop. They still come in with Doritos. And we educate, and any nurse will tell you, we talk to this. And people would rather lose their toe than stop drinking a soda or eating pizza or whatever their vice is.
I think that's starting to change a little bit. I mean, look at our younger patients that we have coming in here now that I tell about soda, and they're just chiropractic patients. They're not even coming in under the functional medicine flag.
Yeah, but they come in. So I think our patients are kind of biased because they already believe in something different that most medical people don't. And they listen. I think they believe in stuff that like most people don't. They believe in the chiropractics. I just think that a few of them are more open to listen and then absorb it. But I think a lot of times our patients come in and they are hurting so bad, and then they just look at us, or they come in with their soda pop, and then we're like, yeah, no. And then they just stop drinking it for the week. And then they come back and they feel so much better. They sleep better.
And so if you take nothing else away from this discussion, talk to your primary care physician. Ask for a fasting insulin.
If you're not going to do anything else with your diet,
ask for an A1C. And you want your fasting insulin, remember these numbers, write them down, take a screenshot. If you need more help, call the clinic. But your fasting insulin, ideal between 3 and 4, but definitely less than 6. A1C, 4.8, but definitely less than 5.5. And blood sugar, you want your fasting blood sugar after you've been awake for an hour or two to be between 75 and 85. Those are the metrics. The most important metric being this one. If your fasting insulin is high, you have to drop that number. And the tools to do so are vast. You can start with the keto diet, but you can't stay on the keto diet long. You also can't starve yourself. You also can't be a worrywart. I mean, these are things that you have to address. If you starve yourself, your thyroid goes wonky, then you go into starvation mode, and your body's going to hold on to everything that it can. If you're stressed to the nines, your cortisol is going to stay high. If your cortisol stays high, your blood sugar is going to stay high. And if your blood sugar stays high, your insulin stays high. If you, what were the three that I said? The worrywart, the I'm going to starve myself thin, and what was the third one?
Stress.
And stress goes with the cortisol. If your microbiome's off, that will affect it as well. So you got to do an approach that looks at all of these and bring it into.
And you may just not be able
utilization.
to change everything at once. So
No,
if you're going to
very
do one
few
thing for
people
yourself, if you drink soda, just stop.
Yes.
Water,
Yep.
unsugared tea, or coffee, because tea and coffee actually do have health benefits unless you load it up with sugar and cream and all that.
Green tea has EGCG in
It's
it.
really
That's
good for
great
you.
for the brain. So
But if you're going to do one thing for yourself, just stop the soda.
So I've done my rant, and just as very foundational metrics, this one's most important. Do not allow that one to start to go crazy, because that's a bad one to have go crazy. And A1C, you can look at it. If you get your fasting insulin under control, A1C and blood sugar automatically come down. So that is the predominant, the master, the whatever you want to euphemism you want to put on it. That's the controller. Update on me. I've gone from a 9.9 on my waist to a 0.98. My body fat is down to a 21% from 22. My intracellular water is above 60 now. It's 61.3. My total body water is down to 65 from the 67. And my phase angle is back up to a 7.6. So very simple steps. I started doing push-ups. I do 100 push-ups a day. You don't have to do 100 push-ups a day. I've done lots of training, lots of CrossFit, lots of stuff. I already said I like to do endurance sports. So I do 100 push-ups a day. I toss my little maces around while I'm walking around. I do some squats. And I've changed my diet, and I'm pounding the fiber. I'm getting 40 grams of fiber in just my smoothie. I'm probably averaging between 50 and 60 grams of fiber a day, and everything is dropping. I am not a special human, a peculiar human. If you do these things, they just work. And that's the wonderful thing. The body wants to heal. You just have to remove the impediment. Sometimes figuring the impediment out is hard.
Or give it the things that it needs.
Yep. A very interesting concept. All your amino acids are all the same, other than the components that are in them that are the proteins. So anytime you have a gut issue, if one amino acid is off, they're all off. So you cannot produce good proteins. So if you have a leaky gut and you're using your glutamine up so that it's your energy source, you're not going to rebuild. You're not going to heal the stomach. It's the body is just amazing. So thank you. If you need help on your health journey, if you're trying to figure something out, I do work tirelessly. I try to figure everything out and help people. And I think I do a fair job. And so thank you. You guys have a wonderful evening.
Yeah.
We will see you next time. I think we